Welcome to Affinity EHR Doctor Training. Now we'll take a look at just how easy it is to document a cataract post-op in Affinity EHR. Review everything documented by the technician. We see the medication that the ophthalmologist prescribed. We'll mark that reviewed. In the chief complaint, we see the technician has entered in the follow-up for the nuclear cataract. We'll review the system information with the patient and review anything the technician documented in pre-testing for the patient here in the vision exam. We'll mark the pupil's visual field motility normal. We'll go into refraction, document our manifest refraction. Next, we'll document our dilation drops. We'll dilate the right eye. We'll save and go into the exam room. We're going to perform an exam. We are going to do a dilated exam, but we're only going to do that on the right eye. So we're going to turn the left eye off. Next, we want to document our impression. So we want to choose the nuclear cataract. For the morphology, we are going to custom morphology, and we're going to put in there that we have a clear and centered PCIOL on the right eye. We'll have that morphology to be remembered, and we'll touch the right eye, and under status, we're going to select resolving. For our plans, the first plan that we want to do is the post-op evaluation cataract. You'll notice here some smart quality PQRS codes. You don't have to select from the drop-down list for these items. Whenever they have the smart quality, they're going to automatically be documented for you. The quality 303 and 304 you will want to select from the drop-down menu. And we're going to choose the location of the right eye. And for post-op right eye, we're going to say day 1. And under day 1, we're going to say continue regimen, and we're going to say done. The next plan we want to document is co-management. So here, we're going to show that we're assuming care. Again, these are sticky fields. You'll show which eye was operated. You also, under the co-management CPT code, if you select the drop-down, you have different options here. This is where you're going to select that 66984, and again, it will remain sticky once it's been selected, and we'll say done. We also want to choose to set the global period. So again, we will document the location from the surgery pick list. We'll select cataract extraction. For the global period, we'll say 90. The date of surgery, we want to put in yesterday's date. We can document the surgeon name. And we can also document the facility. Now again, you can use Siri here and speak into the iPad to have it document for you. And we'll say done. Now we need to have this patient follow up for their next visit with us. We're going to have them follow up in 1 week. And we'll say done. And we can now save our visit note. Now you'll notice a GP to the right of the patient's name in the upper left-hand corner of the visit note, and that is going to start counting your global period for each visit when the patient returns. If we touch the patient's name, we're going to see over here on the right the cataract extraction, the date of the surgery, and it's showing the number of days remaining in their global period. We've documented everything here for our follow-up visit. So we now see the 66984. We also have our medical code. Again, you can override billing and make any corrections here for the billing. We can now finalize our visit and finalize the note. Thank you for watching this video on follow-up visits. The next video in this series is using Copy Forward.